Yes, thank you very much. See, what I would like to say in this context is when there is a mismanagement of glucose homeostasis or abnormal glucose homeostasis, there is also a pattern change or some sort of abnormal or dysbiosis of the microbiota. That has been proved by several studies. Therefore, in disturbed microbiota, there is also a disturbed glucose homeostasis. Therefore, maintaining a good microbiota that leads to a good glucose homeostasis. Because there are certain studies which have proven beyond doubt that microbiota helps in maintaining or rather maintaining euglycemia. It reduces fasting blood glucose and it also improves HbA1c, and also it maintains or rather it reduces insulin resistance. So also there are many studies which also maintains this chronic heart diseases, because if you go through the details of the mechanism of these probiotics, it is seen also there are some short chain fatty acids are being liberated because of the fermentation of the undigested food particles by this microbiota, and that leads to reduction of cholesterol formation in the liver. Thereby it reduces total cholesterol. There is increase in HDL, and that maintains a good environment for the for ischemic heart disease as well. So microbiota or microbiome, it has a definitely link in maintaining these chronic good diseases. It has a beneficial effect on these metabolic diseases like type 2 diabetes, like chronic heart diseases, and also there are other chronic metabolic diseases like atherosclerosis, like dyslipidemia and obesity as well. But it needs more scientific data and proof also to find out the detailed mechanism, how it is very well helpful in maintaining a good quality of life as well as in controlling the metabolic diseases. Yes, this is again a very good discussion or a question we can say. During that COVID period of about 2 years, I have been linked with telemedicine. So I used to get patients relating to GI upset and some cardiac problems as well, because you see in COVID-19, if you see the spectrum of diseases, it was divided into two types, what is a pulmonary and a non-pulmonary. In pulmonary diseases, everybody is known about the symptoms and its complications and the severeness of the disease that leads to multi-organ failure, the cytokine storm, and that patient was needing hospitalization and a very critical treatment for those patients. For the other group, for the non-pulmonary group, we had these problems of gastrointestinal side effects and also cardiac problems. Because see, diabetic patients, they may not attract COVID-19, but individuals with the diabetes, those who had uncontrolled plasma glucose, they were at an increased risk of developing COVID-19. And those who developed COVID-19, you see, individuals without diabetes, the diabetes was precipitated because of an inflammatory changes due to COVID-19 and this development of hyperglycemia and developing these COVID-19, and because of hyperglycemia, you know, there is an expression of AC2 receptors more, and there is precipitation, In hyperglycemia also there is a immune retardation. So there is a diminution of the immune status of those individuals leading to precipitation. If you come to the health problem, the cardiac problems, you see patients, normal patients without COVID-19, they used to get a heart attack, but COVID patients with COVID-19 also, they used to attack heart attack. So there is a little difference. But those who have COVID-19, they can develop complications like heart complications, like they used to have myocardial injury, they used to have this arrhythmias, this acute coronary syndrome, and mainly, most importantly, thromboembolism. So what used to get is patients with a heart problem with COVID-19, they used to complain with breathlessness and fatigue. They used to have palpitation of the chest, or suddenly they used to have a severe dyspnea, developing even heart failure as a complication of a myocardial injury. Am I audible? So those are the situations where we used to treat such patients. But patients developing diabetes or patients with diabetes attracting COVID-19, they had a set up a management protocol. Those who have been on SGLT2 inhibitor, those who have been on this glitazones, they have been avoided. But we found in my practice, as you asked, two very important medications we to prescribe without any side effects are DPP4 inhibitors and insulin. Those who were able to take this insulin, that was an excellent management protocol for type 2 diabetes patients with COVID-19. Lest they had to take the sulfonylureas in controlled doses, giving them instructions about side effects like hypoglycemia, but very freely and rampantly used to prescribe DPP4 inhibitors. Now for this myocardial injury or thromboembolism, actually they needed to be hospitalized. And individuals with COVID-19 with acute coronary syndrome, they were having severe symptoms. Well, with all care, this angioplasty with the PTC and stenting used to be done. But anybody with the COVID-19 with myocardial injury or heart disease, if they were stable, like lateral myocardial infarction or inferior wall myocardial infection, hemodynamically stable, so we used to advise them for a conservative treatment. And after which, when he becomes COVID negative, then actually this PTCA or angioplasty with the stenting was advised, and they used to undertake such a type of treatment in those days. See, this is again a precision medicine. Which probiotic will help the individual with the diabetes in reducing his fasting blood sugar or improving his glycosylated hemoglobin or reducing insulin resistance. That needs to be further evaluated, that needs a further research. Because there are trillions of these microorganisms, the microbiota, and which organism, which probiotic containing which microorganism will be helpful in managing diabetes in a very effective manner, that requires, that needed further research. But anyway, there are some studies, you see, those containing this lactobacillus and bifidobacterium bifidans, and others lactobacillus, some other species, that has a specific role in reducing or controlling this hyperglycemia to a normal level by reducing fasting blood sugar. And as I said, improves glycosylated hemoglobin, and it reduces insulin resistance, because there is a proof. You can do one HOMA IR also, giving some probiotics to a patient with the diabetes, and this how to know whether the insulin resistance has been reduced or not after some time, minimum 12 to 16 weeks. one can go and check his Homa reduce. So that has a beneficial effect. The only thing you would find out which probiotic is important in reducing such biochemical parameters in an individual with type 2 diabetes. So in our practice, you see, there are some studies like you see short chain fatty acids. Short chain fatty acids are formed after this fermentation of undigested food particles after giving this probiotics, and actually they also reduce the formation of cholesterol in the liver because of there is a bile acid mechanisms, and very importantly also some probiotics they reduce blood pressure also. Blood pressure systolic by 3 millimeter, 3.5 millimeter, and diastolic by 2.5 millimeter mercury. That is again a great, and that has a beneficial effect on ischemic conditioning of the patients with myocardial infarction. So reduction of the cholesterol, it improves also HDL, it increases HDL also. So those are certain beneficial effects of using these probiotics in an individual suffering from coronary heart disease. Anybody with the COVID-19 infection, whether he had a flatulence, whether he had a loose motion, whether it is a pain abdomen, whether it is bloating. So in such situations, because there is a imbalance of this microbiota, there is a dysbiosis, considering that into this effect, those who have only any GI disturbances, even today also, whether it is COVID or it is no COVID, but any GI disorder, particularly there are various diseases. You see, there is a reflex disease because the gut. What is this gut this gut chronicles? That is a guide to gut health and disease, because you know there is a connection between gut health, heart health, gut health, brain health, gut health, metabolism. And there is this connection only that gives an idea is to give these gut microbiota or probiotics in GI disturbances, maybe a diarrhea, maybe flatulence, maybe constipation, maybe bloating, maybe your irritable bowel syndrome, maybe your inflammatory bowel disease. Though there are many diseases which has a definite role of prescribing these probiotics in such individuals. The only question, which microorganism helps better in which condition? That needs further exploration of the matter in terms of doing some further research. Very fundamentally, if you see, if you think of the functions of this probiotics, it gives it defense against harmful bacteria. Then it gives a training to the immune system. It detoxifies all the toxic materials, and more importantly, see, it synthesizes vitamins and it causes increased absorption of vitamins also as well. So taking account into these factors, naturally taking a probiotic, it causes better well-being of the individual in terms of controlling his metabolic diseases as well. See, today we find any person very commonly see irrationally nowadays patients are being treated with antibiotics. After taking antibiotic for 2 to 3 days, they come with this dysbiosis causing loose motion, cramp pains, flatulence, and all that. So we stop antibiotic, give these probiotics, it gives an excellent result. Patients with chronic diarrhea, they come irritable bowel syndrome. It is a tremendous and a gold standard treatment for controlling this irritable bowel syndrome. And commonly I prescribe about 4 weeks. And also these natural, those containing probiotics and prebiotics, food materials, that also gives an excellent result in developing their immunity, gut immunity, and maintaining a balance of gut microbiota, and gives a strength, immunity, and fighting with the harmful organisms. And it causes a well-being of the patient, controlling diarrhea, loose motions, and all. See, it's also a very latest question you asked. See, there are some probiotics which create folate, because you see, oral anti-hyperglycemic agent, particularly you see metformin. Metformin, after for a long prolonged use, that causes folate deficiency. So some probiotics regularly we have not started using yet, because there are some recommendations are coming from various international societies as well, to combine a metformin with a probiotic, so that this probiotic will provide folate, and the folate deficiency caused by the metformin will be combated or taken care by these probiotics. But which probiotics that produces folate, that needs to be evaluated. Some reports have come and that needs to be further exploration. But definitely it is a help, it will help giving, because see, metformin also causes some GI side effects along with the producing deficiency of folate. So give a metformin and a probiotic, that will at least take care of these side effects.